program managers that are constantly faced with how to access scarce resources and get sufficient resources to run their programs have challenges which unfortunately aren't dependent always on performance. So you can actually have good programs that that are underfunded and remain underfunded. There are people that understand those processes of how budgetary decisions are made and how they're allocated, and it's an area of growing interest among the public health community. That said, surprising, however, how little attention that is actually given in the public health literature. If you look at, well, as a good example, if you look at the Lancet series in maternal health, child health, reproductive health, nutrition, there's a long series that's been going on now for almost 4 years. And while all of those series make the point that more money is needed, and frequently they attach a price tag to what it would take to, let's say, get universal coverage of nutritional supplementation. There actually is very little attention describing how policymakers make decisions concerning how scarce resources will be divvied up. And what analysis have shown, what studies have shown, and what, in my case, personal experience has shown, is that the worthiness of a program, the effectiveness of a program, is just one element in how a decision is made. It's very helpful to have evidence that something works, but it's not sufficient to open up the coffers. One of the things that is important in determining how you convince a policymaker or policymakers to invest in a particular area, a particular program, a particular sector, is to really understand the policymaker. What levers would be useful to pull to get a positive decision from them. That will change very dramatically from not just country to country, but from state to state, so that what might work for one policymaker would not work for another. In addition to that, it's important to know what other things are pressing for that particular decision maker. There's a tendency among advocates and program managers to actually have a very narrow view. They say, we need money for this good project. Well, guess what? Most policymakers have lots of good projects that they can fund. In fact, they have more that they can fund than they have money to fund it. So you need to know what the competition is, and not to trash another area, but realize what the characteristics of the other areas are, so that you can formulate a message, a package that would give your particular cause a leg up. For example, if you know that that the minister is very, very interested in, let's say, emergency obstetrics program, and that there's a great need for that, and that you want to have a micronutrient supplementation program for young women in risk of pregnancy. And he can't fund both. Well, one of the things that you want to do would be to say, in the micronutrient program, this is something we can put in place immediately. This is how much it would cost. We can do this in this amount of time. And not say anything negative about the other, but the other would be much more complex to do, much more expensive, et cetera. Now, one doesn't like to do that contrasting marketing, if you will, but in fact it's necessary to do when you have limited resources and you need to compete in a very competitive marketplace. Right now, it's clear to, I think, just about everybody in the field of reproductive health and maternal health for that matter, that those are two areas that have not competed well in the current marketplace, not only in this country, but in other countries and also amongst other donors. So I think we have to get more aggressive and more sophisticated in developing our marketing tools. I think the most important thing that family planning managers can do to ensure the success of the program is something that's going to sound like a broken record, is to ensure that they have adequate funds for fulfilling their mission. If they have a mission that exceeds the amount of resources they have available to address that, then they need to revise their mission to make it more modest so that they can fulfill a more modest mission. I think one of the worst things that program managers can do is to try to do too much with too little, because you end up doing nothing. And we have many, many examples of that. So I think that the first thing is to match the resources with the programmatic mission and try to make sure that you have a sufficient resource base to accomplish what you want to.